This is Jordan, the Orthopedic Program Manager and Nurse Practitioner at St. John's Health Center. I'm joined by some members of Dr. Young's team.
Yeah, hi, this is Dr. Yun, Director of Joint Replacement, and we also have Jarek.
Hi, I'm Jarek. I'm the Nurse Patient Care Coordinator and Educator here for Dr. Andrew Yun.
And we wanted to go over the whole process of discharge planning. There are many elements involved, but we would like you to know that there is a specific method to this process, and Jordan is going to walk us through that.
So the first question is, what is discharge planning? So generally, discharge planning is the process that we use to determine what level of care is required by each patient after their discharge from the hospital.
And discharge planning is done in conjunction with physicians, case managers, and physical therapists.
So it's important to understand that every patient is unique. Every patient has a different context at home. There are different levels of social support at home, and there are different levels of physical ability. And the whole key to this is to match the right level of care to the right level of needs of that patient. There are three basic levels of care. So 96% of our patients go home. A little over half of them go home with home health assistance, and the other go home taking care of themselves. The other 4% of patients go to what's called a skilled nursing facility, where they will stay overnight during their rehabilitation.
When does discharge planning occur? So your discharge planning initiates when you are first admitted to the hospital with assessment, and the planning can start prior to admission with patient calls, follow-ups, and at the hospital, patients will be evaluated by the case manager to evaluate your discharging needs and address your discharge planning needs prior to your discharge.
So our goal when you're in the hospital is to make sure that everything is set up before you leave. So you know who's going to be taking care of you as far as home health, or if you're going to a skilled nursing facility, obviously we're going to get that planned for you. So you can think ahead prior to your admission to the hospital if you have a home health care agency that you're familiar with or that you used before, or if you have a skilled nursing facility in mind that you'd like to discharge to from the hospital. So have all that information ready to go if you can before you come to the hospital. That makes everything go a little bit quicker and smoother.
Yes, what makes everything smooth? All of this can, of course, be done in the hospital while you're there with the case managers. But it is really so much easier to prepare yourself, to prepare your friends and family prior to your admission to the hospital. It's worth taking the time to make sure all of these issues of where you're going to be, who's going to help out, are buttoned up prior to setting foot in the hospital.
Who goes home with self-care? Patients that are independent with their ambulation and most of their activities of daily living are those that are appropriate to go home with. So those are patients who are able to get in and out of bed on their own, up and down from a toilet or a chair on their own, and get dressed or do their activities of daily living, which means morning routine type of activities, getting washed up and whatnot. So those patients are ideal for going home.
If you are going home with self-care, we expect that you should be comfortable with your walking, being safe and stable with your ambulation, and you should be also comfortable with doing your exercises that the physical therapist will detail with you prior to your discharge and give you some experience with doing those exercises before you leave the hospital.
Yeah, and this group of patients that goes home with self-care is almost half our patients. And these are typically healthy and motivated, and they come in to the hospital. And after they learn their physical therapy, they're very comfortable. They say, I got it, I'm fine, I can do this. And they don't really need any additional support.
It is ideal for these patients to have some support at home from family, friends, neighbors, but it doesn't have to be somebody with you 24 hours a day, 7 days a week, just somebody who's able to check in on you and provide some extra support where you might not be able to give for yourself. Who goes home with home health? Patients that are safe to discharge from the hospital but would benefit from occasional supervision are those that are best to discharge home with home health. Now, these patients are still able to independently ambulate or go to the bathroom, get up and down from a chair, but need some guidance or reassurance from either physical therapy and or nursing staff at home. It's still a good idea for these patients to have support at home because home health visits do not occur every day. These visits typically occur about 1 to 3 times each week for the first week to 3 weeks. Not everyone requires the same level of care, so these numbers may vary. Now, if you have home health set up prior to leaving the hospital and later decide after the first visit or two that it's not necessary, you are more than welcome to cancel the services. It's much easier for us to go ahead and get them set up for you while you're in the hospital and cancel it as opposed to going the other way around. So if you feel like these services might be something you'll benefit from, get them set up in the hospital and then we can go from there. Who goes to a skilled nursing facility? So those patients that aren't safe to discharge directly home from the hospital, whether based on their physician's assessment or the physical therapy assessment, will be referred to as skilled nursing facilities where they can provide a structured setting with more ongoing low-intensity therapy and just nursing support in general.
Yeah, and the overwhelming majority of patients are safe and stable to go home. And many patients, having just had surgery, are so pleasantly surprised that they are able to care for themselves and will be able to recover at home. But there's a small percentage of patients, around 4%, that need an extra level of support, and that's where the skilled nursing facility comes in. This acts as a safety net for people who need a temporary increased level of care. Patients stay overnight, typically between 3 to 7 days, at which point they are now able to make the transition to home on their own with some home health care services.
So who coordinates our discharge plans? So the case manager is the one who does assessment, they monitor your progress, they plan, and they'll advocate for our patients and connect the patients with support services that are required upon discharge from the hospital. So they will connect you with the appropriate home health agency for your area, or set you up with a skilled nursing facility of your choice, or be able to provide you with information about each of these. Discharge planners work in conjunction with the case managers to ensure that you're discharged to the proper environment from the hospital. So to wrap up on discharge planning, we want you to know that discharge plans are fluid and they may change while you're in the hospital based on your progress. So if you were planning to go to a rehab facility, you might not need that higher level of care and you might be able to go home, and vice versa. If for some reason you're not progressing as fast as we expect you to, then we might send you to a skilled nursing facility for a short stay. But we ask that you think and plan ahead so that you have a good idea prior to admission to the hospital where you will be going once you leave the hospital.
Yes, and everything here is about planning. To the extent that it's possible, it is so important to set yourself up for recovery ahead of time, getting the people in place, preparing your home, and making sure that you are ready once you've had surgery to recover safely at home. It's also important to know that, again, everything is fluid. Things can change even after you leave the hospital. So if you find that you go home with just self-care, but that you need more support, home health can always be arranged after the fact, and vice versa. If you don't need the extra help, you find that you're doing very well and extra support is unnecessary, we can always stop that. So this is a very fluid arrangement.
Absolutely. So hopefully you found this video very helpful. If you have any more questions or concerns, please reach out to me, Jordan. I put my number on the screen, so if you have any issues, just give me a ring. Best of luck. We'll see you in the hospital.